are watching Metropole Television. My name is Simba Elijah Charles Kiage. We are at the tail end of our conversation this morning, and that means is that we are telling you exactly what is also happening in different sectors of the economy. This morning, we want to talk to you about exactly the way the insurance sector and hospitals in the country are approaching the COVID-19 pandemic. Now, this week, we do have announcements of exactly what different insurance firms are doing. And this morning, I'm going to tell you exactly what UAP is doing with a specific hospital within the country. This morning, we are joined by Dr. Nyakango, who is the CEO for Gertrude Hospital. Dr. Nyakango, good morning.
Good morning.
Name right, is it Gertrude or Gertrude Hospital?
Either of the two can do.
Fantastic to hear. All right, so now can you tell me more about this partnership that you have made with UAP? What does it entail? What does it cover?
Okay, so generally as a hospital, we're providing care to children, and most of the children who come to us come via insurance, about 70%, about 30% pay cash for the services. But then those who come to us have the ability to pay for the care that they get. But you must remember that we don't see all the children in the country, and their children, especially in low-income population areas, which some people call slum areas in Nairobi, that can't afford care in Gertrude. So we as a hospital, our foundation, Gertrude Hospital Foundation, have been running a program in two low-income settlement areas in Nairobi, and we provide regular care to children there every week, throughout the week. So UAP, Old Mutual Insurance Firm, through their foundation, partnered with us to provide testing in those low-income population areas for children for COVID-19. So the truth is that it's hard for those children then in those low-income settlement areas to access regular care. Forget about COVID-19 testing and treatment. So this partnership is funded by UAP Old Mutual Foundation, and we as Gertrude provide the care. So really the first part of this is to carry out testing. So we Old Mutual put in 2.8 million shillings to finance this program. And so as we go there every day to provide regular care, we also provide testing for children that we think require testing for COVID-19. So testing, somebody will argue testing is provided for free by the government. Testing has three aspects to it. There's what we call pre-analytical phase, which includes identifying those who require testing, collecting samples, and that process requires what you call PPEs. It requires swabs, it requires transport media, and there's a very big cost associated with that. So somebody always has to bear that cost. What the government provides is what we call the analytical phase. And then there's post-analytical phase, which means once you get the results, then again you have to track these patients, provide them the results, and then channel them to the care process. So this funding takes care of those two phases, the pre-analytical phase for testing and the post-analytical phase. So secondly, of course, the testing requires, and the care for COVID-19 requires protective equipment, what we call PPEs. So part of that funding by UAP Old Mutual also goes to provide the PPEs that is required for that process.
Fantastic. So the next question somebody is going to ask you about this: how long do you expect this to go on? Because the conversation around the economy is that pretty much nobody knows how long we're going to stay with the COVID-19 pandemic.
So the testing itself, I think, of course, the funding for this program will come to an end at some point. But as a Gertrude Hospital Foundation, we'll have to figure out how to perpetuate it, even once the portion that is funded by Old Mutual ends, simply because we already provide care in those low-income population areas. So even when this funding goes out, we as a foundation will have to figure out how to continue the testing. As to the COVID itself, we think that COVID is here it will be here for a very long time. So we just have to learn to coexist, provide care, do our regular business in an environment where COVID-19 is present, because vaccine is not coming out anytime soon, and as we have seen, it's actually not really going away.
What is your basic definition of I would say, the vulnerable within the society or the areas in which you're targeting? And do you have any number that you actually want to taste or target within this period that this partnership with UAP or Mutual is active?
Program in the low-income population area started probably over 7 years ago. And so the approach we took was to identify those people who actually live in those areas. And we went through a registration process through what we call community healthcare workers and the administration, the local administration there, the chiefs and so on and so on. And so we have enrolled 50,000 members into that program. So these are the people that we provide regular healthcare on a daily basis. So 50,000 probably will be about 10,000 households if you take like 5 people per household. And so these people are on an enrolled program. There are people we know, they're identified. There's a regular process of knowing who they are. And so this is the target population. So within that population, probably half of them will be children. So about 25,000 of them will be children. But then for this particular program, the funding is to test about 175. So, but the truth is that in any given population, not everybody is sick. So probably 10% of the 25,000 will be sick, So again, you're looking at probably 2,500 children. So this is the first step to test. The All Mutual partnership is testing the first 175. And then we'll figure out that as and when we get those who require testing, there's a criteria for testing. Not everybody is tested. Yeah. So as we apply that criteria going forward, then we'll figure out what would be the best approach to test the others as and when they require testing.
I want to ask you exactly how you have seen insurance firms respond to the COVID-19 pandemic. There were fears at first that, wow, most of the insurance firms were going to move away from the covering of the COVID-19 pandemic. Now you've just got into a partnership with the UAP All Mutual. How would you rate the response of the insurance sector now to the COVID-19 pandemic?
So it's a tricky situation because 3 issues. One is the government was generally providing care for COVID-19 patients. So I think the insurance company said, yeah, if you have free care, then why should somebody be paying for it? So I think that was their first approach to it. But then I think specific contract with specific employers who've taken up insurance might require that the insurance companies pay for COVID-19. So there are those that are paying, there are those that are not paying, depending on what the contracts were. The umbrella organization, ACI, has actually said that insurance should pay for COVID-19 treatment. So I think we are in that phase where some are paying and some are not paying. So, but we understand that probably that is because of the contractual agreements that they have with those people who have bought premiums. The partnership with the Old Mutual is really from a corporate citizenship approach. This is their foundation, which has said, look, we want to make a contribution, and we want to make a contribution to those that actually don't even have any insurance in the first place.
All right. Now, the numbers of COVID-19 pandemic in the country keep on increasing. I think you've seen that. And so is this deal going to change, if at all, the numbers that you keep on getting from the ground also keep on increasing?
Old Mutual?
If the numbers of the COVID-19 pandemic also keep on increasing, do we expect that this deal that you've actually just gotten into with UAP All Mutual going to change as well?
That probably is not for me to answer. You see, the kind gestures from All Mutual Insurance. So probably it might be them to look and say, look, if the numbers go up, do they want to up the deal? Do they want to get involved more? But I would appeal that probably other organizations do the same thing. That probably, we know it's very tough times for business, but those that can probably should look at the less privileged members of our society and do something about it.
That deal as well, we've seen there's a big focus on PPEs for the health professionals who are also going to be involved in this. Could you explain to anybody who doesn't understand how much risk health professionals put themselves into when they're going on the field to test for the COVID-19 pandemic?
As are first human beings, they have families, they have children, they have husbands, wives, relatives at home. And so they have to be as worried about transmission as everybody else. But the fact that every day they go to situations where they are likely to manage patients who are actually have COVID-19, that puts them as an extremely high risk, because then if they contract the disease, then there's the likelihood that they not only get sick themselves, but they'll pass it on to their loved ones back at home. So it's a very big risk that they take every day, and I think they must be really, really commended and appreciated for taking that risk. But having said that, as people who run responsibility to make sure that they are protected, so that the risk is minimized or the risk is eliminated. And for that to happen, then you must provide what you call PPEs. And PPEs are gloves, are surgical mask, are N95 mask, are what we call gowns, the face shields that they have to put on. And the thing is that it's very costly to provide the PPEs because you have to provide care to one patient, and then you have to remove the PPEs and put a fresh set of PPEs for another patient, because you also don't want to transmit from one patient to another. So the biggest challenge that we as healthcare providers have right now is that the cost of PPEs is extremely high. We've not providing the appropriate protection from to our staff. But we also think that the gesture from All Visual is very good, because they realize that actually one of the key ingredients to breaking down transmission is appropriate protection, so that hospitals and healthcare workers do not become the agents of transmission. So that's why it's critical to have the PPEs for healthcare workers. So number one is protect them, protect their families, but also to make sure that they are not agents of transmission to other people out there.
Fantastic. Now, Dr. Nyakango, I'm going to talk to you about this. We've seen this startling statistic from MOH. They're telling us that the numbers of patients who have been going to hospital during this COVID-19 pandemic have drastically reduced. What would you say is contributing to these figures that we're seeing in hospitals now, Dr. Nyakango?
So it's a global problem, by the way. It's not just a Kenyan problem. Every single country in the world, the number of patients visiting hospitals has dropped by about 50%. The reasons are simple. Number one is that generally people fear going to hospitals because they think that if hospitals are taking care of patients with COVID-19, then if I go there, I might get COVID-19 from the hospitals. Okay, the truth is a bit different. Hospitals are very controlled environments. You get it's much easier for you to get COVID-19 in the community when you're going to buy fruits and going about shopping than to get it in a hospital. Hospitals have been practicing infection control way before COVID-19. They manage even more infectious diseases than COVID-19, like TB and so on and so on. So generally, most hospitals are safe environment for the fact that it's infection control is part of what we didn't just decide to do it because of COVID-19. So generally, generally the general community is not very convinced about that, and that is what they have about going to hospitals. So that is number one. Number two, which is a positive thing, is that interventions that people have taken, hand hygiene, social distancing, and all, that doesn't just affect COVID-19 transmission. That affects flu transmission. That affects many other illnesses that you may get through contact. So that also, which is a good thing, has reduced the number of people who get sick from common colds and diarrhea diseases, which typically are transmitted because of poor hand hygiene, poor social distancing, and so on and so on and so on. So those are the two main factors that are affecting. Then, of course, there's a curfew and a restriction of movement. Most hospitals, especially in Nairobi, are referral centers. So they take care of country. Somebody is in a clinic in Western Kenya, they can't get the appropriate diagnosis. They have to take a bus and come to Nairobi for healthcare. So the restriction in movement also has had a very big impact on people accessing care. The fourth factor, which I think the impact is felt slightly now but will be felt longer, is that because of the economic impact of COVID-19, the ability to spend is also less. So people also postpone going to hospital because they are debating, if this is the money I have, do I buy food, do I go to hospital? So there are those hard choices that families are making. Because of the economic impact, again, some employers are shedding off staff. Medical insurance in this country is tied to employment. So the less people you have employed, the less people you have having a medical insurance, and therefore the less people you have accessing care. So it's really a mixture of all those factors.
Dr. Nyakango, so on a personal perspective, what would you say has been the biggest effect of the COVID-19 pandemic, especially on your activities at Gertrude Hospital?
Biggest impact of COVID-19, first globally, even nationally, economic impact is more than the disease impact itself. You know, people getting sick, people dying, people being hospitalized. Those numbers are not as high. So the biggest impact has been on the economy because there's less trading movement, there's less earnings, so therefore there's less economic activity for I guess every industry. You know, hotels are virtually ground to a halt. A few of them are reopening. So the same thing with hospitals. The number of people seeking care is drastically gone down by a factor of say 40 to 50%. So even with us as a hospital, we are seeing less patients than we were seeing same time last year. I mean, if the patients are actually not sick and at home, that's a good thing. But if the patients are sick and postponing going to hospital, that's a bad thing, because then probably things might get worse and it might even cost them more to go to hospital. So generally, the big impact, I would say, just to answer your question directly, is that there's a reduced level of activity in the hospital.
All right, Dr. Nyakango, as we clear, what would you think you are the best position as Gertrude Hospital to benefit from UAP insurance, UAP All Mutual Partnership, in just 1 minute?
I mean, we think we're the best to benefit from this partnership because we are already providing care in low-income settlement areas. So it's not something that we are starting because of the partnership. We realize there's a gap, we realize there's a need, and this partnership just addresses the angle of COVID-19 testing. So that's one. So if long after UAP has gone, we still be there providing the care. So that's one. Number two, I think we operate through a foundation. So this partnership is first foundation, and what we've done with the foundation is spent every shilling that is given to us goes to the need that is allocated for. So there's high level of transparency, and I think UAP All Mutual knows that, and most of our partners know that whatever money that is given as a donation to do these things is used to the best and to benefit the clients that it's meant to be.
Dr. Nyakango, thank you very much for speaking to us this morning.
Thank you for having me. Have a good.
All right, that is Business AM this morning, and that's exactly what we have for you. You can actually get a recap of this conversation on Metropole TV KE across all your social media platforms. My name is Simba Elijah Charles Kiag. Good morning.